First of all, we want to thank Core77 for inviting us to judge the Service Design Award. We all feel that service design is a very exciting category and will continue to play a large role in the future. My name is Kathy Huang. I'm the founding partner and president at CBI China Bridge, an insight-based innovation consulting firm in Shanghai. We are very excited to say that service design is becoming a more and more important topic here in China. Just like the rest of the world, services here are evolving through the power of design. I feel very privileged to be the jury captain and invited the juries from all over the world, providing that service design is truly universal. First, we have Martha from Gravitytank in Chicago.
Hi, I'm Martha Cotton. I'm a partner at gravitytank and a longtime design researcher, consultant. I'm also on the faculty at Northwestern University where I teach design research to graduate students who are in the M program, and those are students that are getting dual MBAs and Masters of Engineering Management degrees. What trends have I seen in service design entries? I think some interesting trends across all of the entries, which were all really impressive, was a notion of empowerment and co-design. So it was super interesting to see the increasing ways that people are bringing in the end user or the complex web of end users and constituents in a service offer. So that was really interesting to see, and sort of the notion of empowering people to have their own voice was a pretty strong theme throughout the service design entries. I thought there was a really, along the line of the empowerment, just kind of involving people in their own future, which was, very compelling and very inspiring. Also, a trend across the service design entries was really a respect and emphasis on an iterative approach, prototyping early and often, which I think always can be challenging in service design contexts. So it's always inspiring to see the different ways that people are prototyping service experiences and learning from those prototypes and then iterating and so on.
My name is Luis Arnal, and I am a CEO and co-founder of InSitum, a leading innovation consulting firm. Have you seen any cultural differences in how service design is approached in the entries? And the answer is, I believe there are differences based on the experience and the context where service designers work. Traditionally, a lot of service design case studies have been with the public sector, with governments, NGOs, and so forth. This year, we are very excited to see a lot of entries coming from the private sector as well. This means private companies are paying attention to improve customer experiences and finding also valuable opportunities in service design, which is great for the industry overall. A second difference is that some entries seem much more eager to capitalize on mobile technologies, and others are very low tech, but very smart solutions. As we know, service design is much more than doing a great app. Unfortunately, we saw many entries that were just that, great apps, but no service component to them. It is crucial to understand that service design is focused on people, on solving people's problems and the way they interact with each other throughout time. This is something that just by having a great app, it's not easy to solve.
Hi, my name is Adam Lawrence, and I'm the co-initiator of the world's biggest service design event, the Global Service Jam, which takes place in March every year in more than 100 cities worldwide. I'm also the co-founder of a service innovation and customer experience agency called Workplay Experience. We work all over the world and are based in the center of Europe.
In the student category, our winner was the project, long title, but about asthma. Again, another very extensive and very thorough project that dug into a variety of stakeholders, from patients to caregivers to hospital workers, doctors, nurses, etc. It was a really very well thought through look at the sort of the entire chain of people who affect pediatric asthma. One of the things that I thought was really cool about it was they didn't tackle the whole problem of childhood asthma, but rather a piece of it, which I thought was really interesting. By addressing a piece, you can actually affect the whole.
We really like this project because the experience and the solution coming out of it can really inspire many other similar experiences, regardless of illness, context, or patient type. And personally, very gratifying to see such a high-quality work coming out of my alma mater, the Institute of Design at IIT in Chicago. Really good work.
Multiple stakeholder focused and leverage sort of both people's expertise, but also allowed them to contribute, which I think is really key to successful service design. In the runner-up was Notice, which was a really great example, I thought, of thinking through a very compelling solution to a sensitive topic, one around STDs. I thought the entrants used Tinder in a really interesting way to access their end users they wanted to study. Very creative use of existing technology that's out there. I have huge respect for that. And I think also addressing a real clear pain point in this sensitive topic area, allowing users to do a at-home diagnostic kit. So clearly addressing a need and pain point.
Many of the student projects entered into the competition were ideas, great ideas, well presented, but they hadn't gone much beyond the idea stage. This project, Project 42, was a notable exception. It was very complete. It contained all the classic things which you associate with a well-rounded project. There was great prototyping involved. The thing had really been tried and was really moving on. And you had a fantastic impression that these guys always knew exactly where they were in their process. A very professional project which I really enjoyed learning about. Congratulations. It's not just because I'm a cyclist myself that I love the quick fix project. I loved the prototyping approach. There were lo-fi prototypes in shops, in potential places where the bikes could be repaired, even on the streets. There was working in the studio, prototyping the app experience with the mechanic, with other future stakeholders, and they learned so much from this approach. They learned the communication between the bike owner and the mechanic was crucial before passing over your beloved two-wheeler. A great example of prototyping in action, a great project. I can't wait to use this in my own town. Congratulations.
Design methods, notable. Over the last 10 years, we have seen dozens of design method collections, and I like them very much, but it is hard to see novelty in many of them. However, we like this project because it provides a very visual and easy to use interactive tool to browse through the methods, which we believe will be very educational to novice design thinkers or people that are new to the field who want to know how to use some of these methods and apply them to a real situation. This project also adds some new methods that we have not heard of before. Even if the tool is in Korean, we would love to see it in English or even other languages. Notable, Healthier Thursday. This is a very notable entry indeed. We like this project because it is a great example of how two ecosystems can combine to create a great service experience. The ecosystem of healthcare and the ecosystem of retail. The idea of using retail environments to help diagnose the health situation of senior citizens and their neighborhood really is a very creative solution to a real problem, which is that many people are not really aware of the importance of checkups and preventive care, mostly happening after a certain age, more senior citizens. This project, I believe, should inspire other designers to find opportunities in cross-sector service design.
In the notable category, we had It's a Green Day. Really cool look, I thought, at thinking about behavior change, and what a great idea to take an entirety of an organization of people and select them as a way to kind of push behavior change around green issues, linking corporate social responsibility, which again is very important to many organizations, and kind of making it real and actionable and fun for their employees to engage with. So I thought that was a really compelling way to think about behavior change, which is hard. Behavior change is hard. Also notable, we have Gimoto, which I thought was took it at what is now a really ubiquitous part of mobile life, which is the GPS apps that we all have on our phones, but looked at a really specific use case and clear pain point of how to get from A to B when you're walking and potentially want to explore a city and not necessarily need the specific directions. And then obviously some cities, and it looked very much like the Gimoto case was kind of prototyped in Tokyo, which again, sort of the streets and houses, buildings don't necessarily flow in order, so it can be actually very tricky to use GPS. So I thought it was a really cool way of addressing a specific pain point, and something that most map applications don't really help you get through.
Notable. Roipoi is a service that helps people better understand the quality and the variety of information they are exposed in their daily lives. We liked this entry because it aimed to open people's mind by making information consumption more tangible and fun through the use of physical Roipoi device that leans and lights up in response to audio. Notable, unhappiness repair. It was a bit of unusual entry, where most services are about a few providing service for many, or many providing service for few. This service is purely human to human. It combines psychology and a design method to improve people's daily happiness level. It's really a clever way to get rid of their habit and help them to change their behavior for better. Although it's not a very scalable service, it is very impressive still. Combining design method with psychology, try to improve mental health and well-being. Notable, White Rabbit, a service that helps users gain surprising and spontaneous new experience with friends. It solved the pain point of trying to coordinate activities with friends, including transportation and booking. We liked this entry because it utilized many design tools to come up with a fairly well thought out service that potentially to grow beyond the starting location in Chicago.
In the pro category, our winner selected is My Voice, Amplifying the Power of the Citizen. This was a very impressive entry. All of the jurors agreed. And what I really appreciated about it was the extreme thoroughness and extensive nature of the research done. It was a long-term project involving numerous and complex sets of stakeholders across what is, I'm sure, a challenging environment to do research in rural Africa.
This is a great example of how service design can improve the lives of people.
For me, the crucial success factor of My Voice was that implementation was considered from the start. This was not destined to land in a desk drawer, but was designed as a change program, which considered all the stakeholders from the beginning, their individual needs, different technology levels, and how they would work together. A great project.
We believe it is a great example of service design that is simple, original, smart, democratic, and low-tech. Our
runner-up was Futuring Workforce Development. it was another very impressive entry. Something that I'd love to highlight, which I thought was really cool, was something the team created, they call the Wheel of Futures, which was sort of creating a game-like stimulus to involve the end user in the envisioning of their future, which I thought was just a really effective way of talking about this kind of complex and kind of heavy topic to make it seem more approachable and game-like in a way using this Wheel of Futures. I thought it was a really impressive way to go about soliciting user feedback and involving the user in again, the visioning of their future.
Runner-up, Society of Grown-ups. Society of Grown-ups aim to solve the lack of financial education in adults. Not only is needed service, but also the process went through all the aspects of good service design, from designing a brand identity, digital platform, a physical location, and the teaching content itself. Every touch point was considered and designed with the stakeholders in mind in order to develop relationships and the trust needed to provide educations that aim to improve people's lives.
For the notable, chronically engaged. Improving the living conditions, the quality of life, and overall the primary care experience of people living with chronic illnesses is one of the holy grails of the healthcare sector and governments worldwide. And this challenge is not easy to solve by only one stakeholder. We like this project because it aims to do just this by using service design. This team of Swedes used rigorous participatory design methods, obviously, since Sweden was one of the early proponents of participatory design, to involve patients in developing not one, but 5 different solutions to improve quality of care. The solutions, most of them very low tech, but very smart as well, such as conversation guides or appointment guides, seem to be very effective and aimed to make something hard very simple. We believe redesigning the care experience this way really improves the way patients interact with stakeholders and the way they live their illness. We believe this is fantastic work.
Retail is highly theatrical, and I come from theatre, so I found the OSPM Insight Centre a fascinating project. Not just because of the lighting and the staging which they put into their new store design, because of the process which they used to get to it. After a sound research period, they went into full-scale prototyping, building a mock-up of the shop and populating that with real human beings. You can learn so much more when you leave paper tools behind and start to get real by acting things through. It gets very pragmatic and very practical, but it also shows the emotional side. That's important in any kind of product which relates to both fashion and to healthcare like this. I loved also the way the project redefined the roles of the staff members. I enjoy working with frontline staff, and it was good to see them given new functions which made more sense to the customer. Congratulations on this great project. The service design of public services has a great history and an even bigger future yet to come, I'm sure. I especially enjoyed this reimagining of government transactions carried out for the state of Victoria. Based on a great plan by their architectural partners, the team went into a very pragmatic prototyping approach, building the entire centre in cardboard in a warehouse. This let them iterate very, very quickly, and crucially they worked with real frontline staff to do that, testing processes, testing new systems in a situation, an environment which was very, very close to what the real thing would one day be. Not every government embraces what they see as experimental approaches, so I'd like to also salute the Victoria government for embracing this way of working. This was a great project which I really enjoyed reading about. Congratulations.